Oh, we are ready to go. So I am calling to order this meeting of the Dunn County Health and Human Services Board for January 23rd, meeting in our new and I think forever location, room 60. Um, uh, Looks like every member of the committee is here joining us. So let the record show that everyone is present. I will need a motion to approve, and it was a long time ago, our minutes from November 21st, 2024.
Madam Chairman, I so move. As I remember.
Supervisor Steen moves. Is there a second?
I'll second.
Mr. Lamb seconds. Any additions or corrections to the minutes? Additions or corrections? If not, all in favor of approving the minutes signify by saying aye.
Aye.
Aye. Any opposed? Minutes from November 21st are approved. Do we have any public comment? No, all right, no public comment. And I wonder, Katie, just in case everybody doesn't know your staff, if you would make an introductions.
Yeah, happy to do that. So today we have our environmental health team with us. Thank you so much. So Amy is one of our environmental health specialists. She is the brain behind our water lab and really shepherded that process through, and we're appreciative. And then Jeff, you've seen before, he is our environmental health manager and responsible for herding cats.
Which he does rather well.
Yeah,
Great. The review of our next meeting date, February 27th, that's back to regulars. That work for everybody? All right. Okay, nothing on the agenda from me, so we're moving on to Veterans Services. Greg, are you ready?
I am. Good evening, everyone. I will start my evening report off with the memorandum document that I have that just indicating what we've done or been engaged in locally at the state level and updates regarding federal benefits, and then quickly talk a little financial stuff before we get into the 2024 financial report, and I just include on here an overall staff outlook as far as our capacity in the office. So the first item locally, and we're going back honestly a couple months of reporting. And one of the things that I think is probably most impactful, one I'll look at as a cultural level, as county government and employee. We had a lot of individuals. We put out a request as an office to do a care package to send over to some troops, local troops from Alpha Company or Company A from Menominee, and then a couple contingents out of River Falls, which is Charlie Company. And we got a lot of nice stuff, and a lot of staff stopped in, or county staff that stopped in and filled out some cards and stuff. So we got that stuff all shipped out and sent over. And so hopefully with when it's received over there, hopefully it'll come at a good time for them. There's a lot of, their focus is on just doing their job, and less of it is keeping an eye on what's going back on at home. So that was a nice thing. The other thing is I included in the packet just a couple visuals. One is regarding the Wisconsin property tax credit, and that is just we try to help our treasurer's office out, because we'll have individuals that'll show up and say, hey, I'm a veteran, I don't pay taxes, or hey, I've got a disability as a veteran, I don't pay taxes. But that helps them just point like, hey, go talk to the office down the hall, and really the true overview is that they do pay taxes. You are eligible to receive a credit back, but that's if you are 100% disabled due to your military service, and there's a process there. But it helps us explain that to them and go through the process to either achieve that, or to, hey, go pay your bill, then do your tax, reimburse, get that credit back. Yeah. And then the other is just a quick visual on healthcare, basically to funnel people down the corridor to come, hey, talk to us. and then we'll go over and explain process, how to apply, and the true benefits that you will receive with that free, if not low cost healthcare, because it really can be impactful with individuals on a fixed income. The next level on the state level, we're invited to meet with governor's office on their upcoming budget process, and it wasn't with the governor. I was a little disappointed, but apparently they got staff. So we had a meeting with those folks, and that part of that was as the representative for our association, as the president. But in that process, I had a past president's meeting, because I bring those folks in because of their institutional knowledge, and then we have a legislative committee member who's been really integral in a lot of work within the legislative area, super knowledgeable. So I had him part of it because, again, you can be the face of something but not have the full knowledge of it. And so I thought it was a very good meeting, and I just included, I did a summary afterwards. So then kind of that walk away for the governor's office, but none of this is actually speaking entirely on behalf of the association because they have to approve it. But using the main players in it kind of gives at least an idea. So overall, as an association, we want those offices that only have a part-time veteran service officer to receive any type of gain for a grant, so that they can lift their office up to the capacity that it takes, because oftentimes they're unable to do as much when they're only part-time, and not worrying about those that have full-time service offices. We want to bring up the other folks. And I would say the other, just a few of the other things, and I've talked a lot about them, but they're in order of precedence. I'll let you read them. But the funding for the MIA POW research, probably periodically you'll see things in the media that we're bringing one of our lost veterans home. And that comes from they're identified either from, Korea is probably one of the main places they're identified, and they're able to come home to have that dignified resting place, and the family members are able to get a little bit of closure, say their goodbye, and we want to absolutely support that as well. I think that there's nothing that can be more impactful than saying a proper goodbye and having closure. So that kind of gives you a little bit of a idea kind of where our association is, but then it also kind of is really how we approach things at that local level as well, with what we want to help and support. On the federal side, I already talked about the healthcare quick visual that we've put out to have posted. And I think that there has been the improvements, automation, and there's a lot of discussion regarding the use of AI and how impactful that may be with businesses in the future, if not now. On our immediate level, we're seeing some of the automation. It can be good when it processes dependent applications that we put in, so people can get their money quicker. When they have a baby or they get married, because they can receive a little bit more money. But then on the other side, sometimes automation gets it wrong. And then we're in a 6 month to a year process for a very simple application. So that's kind of, I think it'll all level out. We'll probably know what that baseline is at some point. But it's coming. It's going to run us over a little bit, but it's also going to absolutely create some improvements for sure. Financial side, I'll get into that here in a little bit about just a quick recap on the 2024 budget. I won't talk anything about the 2025. We're one month into it. So the next document provide Excel document that just identifies kind of all the areas that we touch throughout our local residents, from medical equipment, loan closet, the numbers on that, and this is all annualized. This gives you a good look at what 2024 looked like. And then as we'd added in the real money, the retroactive payment money on the bottom, where that money actually goes into people's checking accounts to buy groceries and pay their utility bills and televisions. And so I think that I think as we go forward, again, I kind of talk about the baseline. We're a couple years into tracking that amount. So I think I would anticipate that baseline is probably going to be $800,000 to $1 million each year. But we'll know as we continue to track that and be able to identify if that is what our true baseline is. And of course, we're still feeling the impact of the increase of additional benefits that came from the August 2022 PACT Act, which is an incredible recognition of the toxic exposure for all of our service members throughout the world, not just in the Middle East or those that served in Vietnam, but it happens right here at home. From Camp Lejeune to Fort McClellan to other bases where there's just a lot of toxins from a variety of things, and it has a long-term impact. But sometimes we don't know the impact it has on our body or our systems till we get down the road 30, 40, 50 years. So talking about our impact statements, we try to always produce a couple on here, and the first one is kind of make you think a little bit of why would any service member that I believe you served more than 90 days on active duty and you develop MS, why would that be a presumptive disease? And so that just draws questions for me. But we had worked with our veteran specialist, Jessica, had worked with gentlemen had just post-military, because you have, if you don't, it's 10 years, you develop within 10 years, they consider it caused by the military. What? I don't know, but something that everybody goes through causes it. This individual was diagnosed 14 years later, but really the whole approach was on the continuity of symptoms. His service treatment records was riddled with symptoms. And so you write up a nice narrative on a claim. You rule out other risk factors, even though we're not medical professionals, but we can say, hey, don't smoke, don't drink. You create that presentation of ruling those out. Then you focus in on, here are the symptoms that were experienced. Here's the continuity of them in the treatment because you just don't get a diagnosis right away of MS. So it was a really important win, especially for that individual and for family and stuff, because there's a long road ahead. The additional one is
Somebody really stubborn.
yeah. And people heard the name, they'd all know him. Good, super good guy. Worked with him a long time, but finally broke him down. But he is, and that's the generation. I've talked about that before. There's many differences generationally, and that Korean War generation, World War II generation, prideful, strong, focuses on everybody else, family, but when you have injuries, it is okay to recognize them. The biggest benefit for him is now there's no longer state money going into neighbors of Dunn County. It's going to be federal contracted, although it is state money, comes down through Medicaid, but federal contract, he qualifies now for a VA federal contract, and the neighbors staff, they're great about, it's just an easy notification, like, hey, this is coming. They make contact with the VA's contracted nursing home specialists, and they make it happen. So it's a good thing for this particular veteran, because they also, that generation, they can live very well off of $10 a month somehow, because they're so good with their money and everything's incredible. And so I think that this will have a good impact on him. And for me personally, I think it's something long overdue and well deserved for this individual. Any questions about any of the information I've went over so
Supervisor
far?
Dean.
Yeah, Mr. Quinn, I see on your impact statement, you didn't include any monetary figures for either one of these. Is there a reason for that?
No, well, it was minimal, for Korean War veterans. The VA makes every attempt for a veteran that is older than the age of 75 to expedite the claim. And so it was like a month or two retroactive money. I mean, it's still good money, but it wasn't anything, that's not the story of this one. And I think I can't speak to the first one. There is some retroactive money, but my assumption is that it was it was a quick ruling, and it wasn't, the story is more about yeah.
Supervisor Hagan.
Thank you. So Greg, in November at the very last minute, is that all right if I?
Oh, yeah. Sorry, I should have probably had it in my report.
No, it's all right. But Greg was so kind to visit Anderson Windows Manufacturing last minute, like the week of Thanksgiving, to come and set up a table because Anderson was doing a veterans outreach program. And so I know when I left for the day, I saw people at his table talking with him, and I talked with other people that I worked with, and there were people that like didn't know the VSO handled appeals. They just figured once their claim was denied, that was it, end of story. So they were really happy to see that. There was some that were about the home loan program, and I know at least one person who had a negative view of the VA as a whole, who then changed their mind. Like, hey, this is actually kind of cool. So, and I know a lot of people really love the gun locks. So I kind of wish I'd grab them. That was really awesome. So
We can get our hands on more.
perfect. Yeah. So great showing there. And thanks again for showing up.
Yeah, thanks for the thanks. Greg probably doesn't get enough of those, so I appreciate that, Supervisor
Yeah,
Hagan.
Win. I spent probably half hour talking to my cousin while I was there too. So it was a huge win. And those gun locks are also down public health.
Yeah,
I'll
they're
give a
in
plug.
the
Yeah.
vending machine.
Every floor except the top floor in the building, so you can get some. I'll quick, just the
Finances?
2024 financials. I have a meeting scheduled next week with Beata and Sophia to talk about kind of closing out 2024. We don't have lingering revenue. We don't have lingering expenses that come in. So things get shut down pretty quickly on our end. But there is we've got to just move a little bit of money that into the grant from what some other levy costs would be, because we got a little bit, we didn't spend out our entire grant. So we're going to just meet, clean that up, and then talk about
So the 9676, well, it doesn't stand, or it does?
everything. Yeah, it stands. We're not over budget. Everything.
No, clearly.
Yeah, everything is good. I would anticipate it'd be about the same unless we had a couple, like a quill bill for $10.
Okay.
come through.
Okay, all right, thank you.
That's all I have. If there's any additional questions.
Any additional questions for Greg?
All right, thank you.
Thank you very much. Thank you very much. On to public health, KT.
So you're going to hear quite a bit from the Public Health Department.
Absolutely.
So I'm going to keep my comments brief. You guys had an update from us in the packet overviewing a couple months worth of outreach and activities. So hopefully you guys were able to dig into that. Happy to answer any questions about that. I did want to point out that we are very happy that we have a public health educator back in our ranks, because it has really increased our ability to be present and be out in front of the public. So that is great. You have some data in your packet as well. So you saw data from our reproductive health group as far as the get yourself tested. And so I think Carrie did a fantastic job putting that in a data representation where it's fun, it's numbers, but it's not too much. And then you see our like Greg shared, we do have gun locks in our public health kiosk, and you can see the distribution of how many items we have given out and where they're typically going. So by and large, seeing use within Menominee, seeing Narcan, seeing gun locks, and a variety of other things. But we have had some far-reaching as well. And so what that helps us do, and folks put in their zip code, is that we know whether or not we need to do additional outreach in other parts of the county as well, or if this is reasonably accessible. So happy to watch those numbers and happy to get that out into the community. Any questions on anything I provided?
I'm curious, if you don't mind, about why you think the WIC numbers are going up. Is that due to the outreach work of your staff?
We have an amazing staff, and I think that we are meeting people where they're at, largely with our ability to provide virtual visits. Folks have a lower barrier to accessing services. They still need to come in regularly to have their heights and weights and check for
Right.
anemia and if they have a lead exposure, but we're able to meet over the phone or via video, and that's just much more comfortable for a busy family. So I think that removing those barriers, as well as the continued need, you guys saw that about 1 in 5 children under 5 in Dunn County are WIC eligible. So we know that we have an unmet need. I'd like to see those numbers go up as far as supporting the amazing families in our community that need help making things go a little bit further, covering things like car repairs or taking their dog to the vet. This can offset some of those other expenses where it makes things a little harder to stretch. So I would, to answer your question succinctly, yes, Grace and her team are amazing, but there's also a significant need in Dunn County and a decreased barrier to use the service.
Do send our compliments, though, to Grace. I think that it's really nice to see that. My only other question is, and it's probably for Jeff and Amy, how long you think the DAP revision will take? And is it lengthy? Is it years, or is it months, or?
So their last couple revisions have taken about a year or less. Yeah.
Yeah.
And
So yeah, the lodging code that is currently going through, it all depends on legislature. So each committee has up to 60 days once DATCAP
review
gets
that.
to them. So DATCAP has to have their rule to the legislature by July. It goes through 3 committees, so up to 180 days from
Okay.
July. So,
Okay.
but like the food code, they're just writing the scope statement this year to hopefully be in place to 2 to 3 years. It's usually a 2 to 3 year process for those codes to
Okay.
be updated.
So we have a little while to
and if they get
compensate or whatever.
if they get significant feedback like they did with lodging, campgrounds especially, we had a kind of a back to the drawing board after significant public comment. It may take a little bit longer.
Okay. Any other questions for KT? Go ahead.
So you also have financials. Oh,
Sorry.
sorry.
I'm sorry, Supervisor Hagan. I wasn't paying
No worries.
attention.
I was writing at the same time. So first of all, with the public health kiosk, great job. So those are awesome numbers to see. It's just great job on that. So that's really cool that we have that service. I was wondering for the get yourself tested portion, let me scroll down to it. The dual protection section of that. I was just curious. So does that cover pharmaceutical prophylaxes as well with that? Because what I'm thinking is that there's some population that think that just having pharmaceutical prophylaxis alone and not condom use as well is sufficient enough for STIs and things like that. Is that something that you have been seeing, that type of mindset?
I can't speak because I'm obviously not a clinician. I'm not in those rooms, so I can't talk
Sure,
about that.
sure.
But it is something that we definitely educate on their ability to prevent STIs using that dual method. And so we do measure that because you're absolutely right. Some folks are more comfortable with one or the other. We encourage folks, if they do use a pill, that they also use a barrier method to keep themselves healthy.
Sure. And for a pill, I'm not talking about like the pill, but other forms of that type of safety or yes, health safety. All right. Cool. Perfect. Thank you.
Budget. Finances.
Thanks for helping me place myself on where we were and where we're going.
You're quite welcome.
Yes. So you have our end of year as we know it right now. We do know that we'll have a couple additional charges come through. We're still waiting for some of the birth to 3 things to come through because it's the end of year. So they have to do all of their tracking and then they have to get it to us. And so we know that we've got a couple more charges coming through. We also think we have a couple more revenues coming through. So there will be some slight changes. You do see that we do expect to be in the positive. And of course, there will be a carry forward for public health ARPA because even though we heard for 3 years that we were not going to get a carry forward,
Right.
they gave us a carry forward in November. So grateful that we're able to use that money locally to continue to support birth to 3 and some internal training and support. But the vast majority of that is going to go back to levy, which it's good. It's good.
Any questions for KT on finances end of the year? Yeah, Dr. Hall.
So I just had a comment on the STI testing. Again, I thought it was notable that there were 97 people tested and 17 people who got treatment. So that is a very high positive rate, right? So we're finding a lot of infections, which isn't awesome that there's a lot of infections out there to find, but it's awesome that we're finding them and treating them. So, and it probably portends the need to do even more outreach and testing and expanding those services or getting people to avail themselves of those services even more, because that's a really high positive rate.
It is a high positive rate, and we do provide partner treatment as well. So if there is a partner involved that we can access and they care to access, we can get them set up with the same kind of treatment without having to come in, which is really good. Again, removing barriers, making sure that we're removing transmission and being available for when people need us. So the walk-in Wednesday where people can come in and be tested. We also have self-swabs for folks with vaginas. So that's really nice because people expect to have post-COVID, one good thing, right? We expect to take a test and know the answer within and now we can do that for some STIs. And I think that's been really well received.
Supervisor Hagan, did you have a question?
Oh, no, I was just commenting that was along the lines of my thinking as well with the education outreach for that dual protection is that mindset of some think one is good enough. Yeah.
Yeah.
All right, thank you. We do have an action item later on the agenda, but do you want Jeff and Amy to, while they're here, to talk about it again, or up to you?
It's
What you had planned.
So my plan was that we would take it up as the agenda unless you guys wanted to amend the agenda. I think we're further on in the meeting so that we're not going to amend the agenda.
All right.
Okay.
Let's move forward and move. Anything else for KT? All right, moving on to public health. Thank you, Paula.
All right. I filled your packet with documents
You
this
did.
time.
You
Did I succeed in getting the maximum number out of everybody?
I loved the graph.
Yeah, love the graphs. And I told Betty again, thank you so much for the graphs because they love them. The Family and Children's Unit documents regarding placement costs and the graphs are what we discussed way back in November, if you can
Right.
remember. And we didn't have them done for the packet for you to view. And so I said I would place them in the packet this time. So what I would offer the opportunity, if you have questions regarding them, I could answer that. Otherwise, it's there for your information. and where we're at.
Any further questions about the out-of-home placement?
Okay.
Okay, all right, go ahead.
Next, well, let me share with you what we're doing this year. We, as a department, we meet every other month for our all-staff meeting. And during that month, we have picked one unit or division in our department to give what we call a bright spot. So talk a little bit about their program and give maybe, something good that's going on, something positive. And what we've asked them, Becky and I have asked them to do is to then that month come to the Health and Human Services meeting to talk about that program and talk about the bright spot. So next month you will have Family and Children's here. So you'll hear less from me, less documents from me, more from them. And then 2 months later, we'll have the next. So just so you know what's coming up this year so that you have some information from the actual people that are doing the work. So the documents that you have also will help you understand some of the programs or the out-of-home care issues that we're having there. Next, I would bring the my director's report, and in there, I chatted a little bit about the new grant that we've received that Sarah Olinger worked on, and it's a parent peer supports in youth and family crisis grant. And actually, what happened is we applied for it. There was 2 different entities that applied. The other one wasn't qualified, so we got double the money, which was really nice. In that, and what that does is allows us to contract with a provider that has parent peer supports. And what peer support is if I have a child that has a mental health or behavioral health issue, alcohol, drugs, or a mental health issue, and I would like support from another parent that has a child that has something like that as well. It is working with that parent that's been trained, how to work with the parents. So it's like somebody walking alongside of you that's been there, done that. And so that's really neat because we've not had any of that type of work in our county before. We've had peer support, so adults getting, that, but not a parent getting that. So it's really a neat thing that we're able to do and implement. So that's really exciting for us. Any questions on that? Okay. And then the next piece was the RWC, which is Recovery and Wellness Consortium. I gave you some information about a lot of changes there and things happening. I'll keep you up to date on that. I just kind of wanted you to be aware of the changes with Chippewa and kind of what we're working on. And we'll move forward as things change. I'll keep you updated.
Has the Chippewa County position been filled?
I think they just had interviews this week, maybe, if not even today, maybe. I'm not 100% sure, but it was coming up. And so then, let's see here, and I put in there that I'm the chair until the governance says that is the Lee County to chair that committee. But since there's not a director there, they move me in there. And then once that job's filled, then I'll move out of there again as the vice chair. And so I want to also point you to the packet in there. I had a copy of the fiscal report for RWC for 2024. And had that up. Now it's gone. Oh, here it is. Okay. And so this report gives you a couple things. First of all, in there in the spreadsheet, you'll notice that you can see Dunn County numbers, and it gives you the type of services that CCS provides. You'll see that like 16 different services there. And then, how many dollars are in each of those services. So you can see that just in Dunn County alone, we had $1.4 million worth of services to adults and children in this program. And so what that does is brings $1.4 million into our local economy as well, because that's being spent on providers and care services here in the valley. And so it's kind of a twofold. We're getting the services that are needed, and we're helping with that additional funding into our economy. And then if you look at the summary of the 9 counties total, you will see that
13 million.
13 million for this program, and you'll see 857 consumers. I mean, I remember when we started, it was under 100, and now we're at 857. That's pretty amazing, the number of people that we're serving in that program, getting help. So I thought that was important for you to know.
Mhm.
Dr. Hall,
Can you remind me where the funding for this program comes from?
it's Medicaid.
That's what I thought. Thank you.
Mhm. Yep, we bill Medicaid for that. And it's we call it fully funded. Yeah. So there's different things that come with that, but, and how that's done. So any questions on RWC? All right. And then in my director's report, you'll see that Jessica was able to get her hands on the dashboard for the time period of unwinding when we were moved in that direction. And you'll see the data on that provided there. And I didn't know if you had any questions on that.
Any questions on that? Unwinding of the COVID area benefits? Okay.
Okay. And then lastly, I put in your packet, Wisconsin Counties Association provides every once in a while a document called Forward Analytics that provides information as to things that are going on or hot topics. And in this document, they talked about the declining births and youth and what that means, the impact on Wisconsin. You can tell from the document that in 1997, in Wisconsin, we had 66,490 births. And in 2023, we had 59,719. So quite a drop. And they're predicting that will just continue with the way family structures are and all of that. And what does that mean for our schools, our workforce, all of those types of things to keep an eye on? And how do we then fill the needs that we have for all of those areas, and really taking a look at that. So it was more for your reading pleasure if you like data. So Dr. Hall.
Dr. Hall.
So thank you. I really did appreciate it and find it really interesting. I thought it was also interesting that net migration of young families into the state from other states has also decreased significantly. So thinking about how we can make our communities more attractive to people so they'll want to come here and actually accept our job offers when we issue them, that would be great.
Chris and I just attended a month or so ago a presentation about workforce participation and the really serious implications all of this has for workforce, and an organization that is trying to recruit businesses and families to sort of fill the void. It's startling, actually. Supervisor Steen.
Yes, Dale Knapp does a wonderful job with Forward Analytics. And one of the other things conclusions he came to is that private industry and public employers, the ones that are going to be successful going down the road, they're going to have to reverse a 50-year trend of taking away benefits and taking away or trying to hold wages down, because in the future, because of the demographics, the businesses and the counties that is going to be successful are going to have better benefit packages and more enticing wage packages to entice the people to come and also to retain the people. So I think that's should go into our planning because in the end, you don't want to be at the wrong end of the stick, so to speak. Thank you.
Yeah, and more family-friendly opportunities, childcare, et cetera. I mean, it's a huge ongoing issue. Yes, Dr. Hall.
Well, just to add to that, we recently had someone decline our job offer in large part because our school district referendum recently failed, right? So it's so multifactorial, right? People are looking at all of these different sectors of a community when making decisions about where to
Yeah,
move, and
sure.
it's really tough.
Supervisor Hagan.
Thank you. I attended the Wisconsin Counties Association this past year, and this was one of the topics that I attended. And one of the unfortunate short-term solutions that they came up with was that potentially more people who are currently retired may need to come out of retirement, at least in the short term, to fill it up. Well, that was one of the things that they knew a lot of people are going to say, but with the declining workforce, they're
Right,
kind
yeah,
of putting it
sure.
out there that potentially we may have to look at that at least until we can build up the workforce
But
coming
it's a
after.
pretty short-term solution, one would think.
Yeah, I mean, I'm not saying anything.
Yeah, absolutely. All
I
right.
think it also, the other thing that goes without saying is housing. If you don't have attractive
Exactly.
housing for people, they're not going to come to your community. And so that's
Exactly.
certainly a hot topic for us as well.
Yes, certainly
Have to
Supervisor
say that
Steen.
as a hat chairperson, right? All right, that's what I have for my report.
Supervisor Steen.
Yes, I just have another comment regarding moving forward. All levels of government traditionally did not think about a lot of this stuff. Didn't think, I mean, Dunn County, any county, they never thought about housing. They didn't think about daycare. They didn't think about any of this stuff. And now school districts, city councils, villages, they all have to think about that. And I think we're all in this together. So I think if you'll see more collaboration and planning to be as effective as we can be with the resources that we have to achieve what we'd like to achieve. And that to do that, that you got to change a mindset of what's been traditionally done, because older guys like me would say, well, what are we even thinking about that for? Well, we have to if we're going to be competitive and move our communities forward as a unit rather than sticking in your own little silo. Thank you.
Yeah, good point. Did you want to talk about finances?
Oh, I love to talk about money.
Love to talk about money. Let's talk about money.
I like to talk about money in 2024. I'm not so sure about 2025 that I'll enjoy it as much. But for 2024, right now, our projection is 411,000 to the good. Certainly, we are still 2 to 3 months out with revenue and expenses. And so this could vary some, but we're sitting really good right now. And again, just as a reminder, 2025, we don't have invoices in yet, but we're projecting with a couple of really high cost placements that
Out-of-home
it's not
placement.
going to look like this next year.
Right.
I'll continue reminding you that, but we
Right.
probably won't have a good fiscal report until the end of the first quarter for 2025.
Yeah. All right. Any questions about the to date end of year report? All right. Thank you. All right. Moving on. Next item on the agenda is review of the December 2024 vouchers paid. I'll need a motion to note review. Dr.
So-
Hall, do we have a second?
I'll second.
Mr. Lamb seconds. There's nothing unusual in here, anything? Yeah. Amount is $698,171.69. All in favor? Aye. Any opposed? Okay, vouchers are noted. We have a health department budget adjustment, pretty simple. Grant. Anyway, two contractual changes. And I'll need a motion to approve the budget adjustment.
I so move, Madam Chairman.
Supervisor Steen, is there a second?
Yes.
Dr. Hall, any further discussion? Pretty routine. All right, all in favor?
Aye.
Aye.
Any opposed? Budget adjustment passes. And now we are on to Jeff and Amy. What you have before you, you've seen this before. You haven't seen the resolution, but you've seen the narrative and you've seen the data about the fee changes and how that was derived. And now what you have before you is a resolution that designates our authority as a Health and Human Services Board to approve this, and to send the resolution and the fee structure off to the county board for approval. So that's true. It doesn't go to the county board. We approve it. I don't know why I always say that, because it's routine. It goes to the county board, but it doesn't. This is our decision to make. Jeff and Amy, do you want to add anything here since you're both here? And thank you for that.
Sure. Just a reminder, I know when we talked in November, we talked about our debt cap fees. We talked about the transient non-community fees, but also Amy's here also because we're proposing nitrate fees as well. So just that reminder of those three things that we're discussing today.
Okay.
So good news is that Amy's put a lot of hard work into getting our bacteria lab portion up and running, but also the nitrate portion of it. It's no small task to get that
Sure.
accreditation, and to be able to pull all the data that she did for costs of supplies, our time. Just a shout out to Amy for that.
Thank you, Amy.
Work.
Good data.
Yeah. Anything you'd like to add on water lab nitrate testing data or what we've done so far?
I don't think so, but if you have any questions on the information about supplies or anything, I'm happy to answer.
Any questions on the water testing? Dr. Hall?
If I had colleagues in my biology department who wanted to send their water samples to you for nitrate testing instead of doing them themselves in their lab, is that an option?
Yes, they definitely could. So we do private samples, and we can also do
Okay.
compliance samples if it is a DNR compliant sample type situation. Probably not. Okay. But yes, we certainly can, as long as it's drinking water, because we're not certified for wastewater.
Okay,
So just strictly drinking water.
thank you.
Mhm.
Not surface water.
Correct.
Ah.
Correct. Yes.
Not yet.
Not yet. Stay tuned.
Is that in the works?
We've always got something up our
We've
sleeve,
always got
so.
something in the works. All right. Well, I don't know if you want me to read this resolution or if everybody has digested this. All right, I'll need a motion. Dr.
Oh.
Hall,
Yep.
Mr. Lamb. All right. Any further discussion? Questions? All right, all in favor? Aye. Any opposed?
No.
No, resolution passes. And unless we have announcements or anything, we are ready to adjourn. Supervisor Steen.
Yeah, I have a question. As a committee here, have we discussed our fee structures? I know we want to shoot between 70 and 100%.
Correct, we decided that.
Yeah, well, that's what we were shooting for. I guess my question is, I would lean towards the 70% versus towards 100%. As the county generally offers the services, does that make any sense? Or are we going to just hit it up so it's 100% of cost?
Let's defer to the health department staff on that. What their thinking is.
Yeah, so the goal is 70 to 100%. Us getting to 100% is probably an unrealistic goal with the changes that we see coming in the next 3 to 5 years with DATCAP raising their fees. They're raising the percentage that we reimburse them. So looking at just keeping up with the state increases, it's going to be hard on our businesses for us to keep pace with that. But I think the issue is the less we can cover costs, the more tax burden that puts on the levy and
Right.
on the county.
Right.
And if I
Katie.
can just add one quick thing, our concern is that we never want to take more in than we actually need, because we don't think that the folks that are licensed really should carry the cost of the folks that are unlicensed when we have complaints and follow-ups. So there's always going to be a little amount that so-and-so's selling whatever out of the trunk of their car. We go and do the investigation. That isn't something that a mom and pop restaurant should burden. So we want to have a little bit of a space so that we're not bringing in more money than we need, first and foremost. And secondly, that we're not burdening licensed folks that are doing the right thing by being licensed and adhering to the code for folks that are not.
And I will add, when we reviewed these changes some time ago and people had concerns, the staff did a really excellent job of listening to that feedback and making accommodations. So I think that was, my compliments to the staff on that. So we're probably never going to get to perfection. But,
Thank you for that.
okay. Anything else? Any further announcements, Supervisor Breslin?
Katie, on that, what you just mentioned, okay, so I agree with you 100%. Someone that's following all the rules, why should they be penalized? The question is, the mom and pop or whoever's selling out of their trunk, do we have a way to penalize them?
So yes, we do.
Good
And thank you.
question. Good question. God only knows what they're selling, right? All right, any further questions, announcements? If not, we are adjourned. This might be a record. It might be a record.